Good afternoon, everyone. Thanks for joining us again. It's 2 o'clock on Friday afternoon. Thanks for joining our Facebook Live Town Hall meeting. I want to be sure that we're live. I just want you to know that on my screen it still has the... we're good? There we are. Okay, good. So we're trying out some new technology that I hope will make it a little bit easier for you to hear us. You can see in front of me our 1950s microphone. It's not. It's a podcast mic, and some new technology to make it a little bit easier to follow along. So thanks for joining us this afternoon. Wanted to cover a few new bits of information. Before I do that, I want to ask you to join me in thanking our sign language interpreters. They've been with a lot of folks these last couple of weeks, and so we thank them for their commitment and help in helping us communicate, and we're very, very grateful for the work that they do. So this afternoon, I wanted to let you know that we're going to be coming to you live now every Wednesday and Friday. The goal as we start this reopening process, and it is going to start in a few weeks, or a week and a half, the goal is, as we start this process, to be as open in giving you information as we can. So you'll be hearing from us twice a week, Wednesday and Friday. And it'll give you an opportunity to ask questions. So if you have a question, ask it in the comment section below. We wanted to cover some additional information and some new information. As we do that, I also want to let you know that Governor Cuomo was in Dutchess County today, held his press event at Marist College. We're grateful to Marist College. But it's a good reminder that at this time, as we start to prepare for restarting economic and community activity, we still ought to encourage social distancing. We ought to continue to make use of face coverings as we can. And of course, if you can't engage in that social distancing, you're out the grocery store or on the rail trail, you want to be sure that you continue to use a face covering just to protect yourself and others, and mostly to keep us from spreading any disease, quite frankly. As I've encouraged before, it's perhaps the least selfless thing that we can do, and it's basic consideration as we continue through response to this pandemic. So I want to start with an update regarding the Duchess Dashboard. I know that we're going to be showing some slides, I think, talk a little bit about this. So if you visited duchessny.gov and the Duchess Dashboard over the last several days, you'll notice that it was under reconstruction. And I wanted to explain that a little bit. I think it's some of what you already know. All of the data points on the dashboard, except really active cases, are submitted to the state of New York from multiple locations. And counties all across the state have been grappling with what numbers to put up publicly so that you have a clear view as to the situation in any particular community. So all of the data points and all of the data that you see on that dashboard is collected by multiple entities across Dutchess County. It's not Dutchess County government. In fact, we don't get any of this data directly to us. This is provided to the state database. And then that data is pulled together locally by the Department of Behavioral and Community Health. In our case, we have an epidemiologist, a single person, one epidemiologist who works with a team of people to try to validate that information. And I don't want this to come across the wrong way, but early on, I think we made the wrong choice for the right reasons. What we decided early on to do was to, as the data was coming in from the state, was in essence to work very hard to validate it as it was coming to us. It's just the state broadened where data comes from. Of course, we know that the numbers grew at such a rapid pace that there just is no way that the local health departments have even access, let alone the capacity to sort of validate each data point. So we took some time to update the dashboard. It is live again today. You'll start to see those numbers again. And what you will note is the county is making use of the state's, sadly I hate this particular data point, but using the state's death and fatality number. And the reason that we decided to do that was because even though we still will validate each of those cases, we just can't keep up with the reporting that comes from state correctional facilities, nursing homes, individual locations throughout the county into the state database. We don't have access to it. We don't necessarily get to see it with any detail, and there are whole cases that we'll never be able to kind of validate. So what you'll see now on the dashboard is the data points as they're submitted to New York State. We still have a good number of we have all the same information you're used to seeing, but for clarity and to remain exceptionally clear with all of you and very honest, the confirmed cases, the deaths, all come into the state of New York. Now, the active cases we manage. We know those cases because the health departments at the county level are responsible for doing that. So when you go to our website and you see the dashboard, you'll see those data points as you always have. You can rest assured that the active cases and the municipal numbers are accurate, and they're vetted by Dutchess County government. So we know in each of the municipalities which are those active cases. The other data points, all valid, all appropriate, all accurate, but rather than delaying review in particular of the death-related data points, we're simply going to report to you what has been reported to the state of New York. So this doesn't change the condition or the status of the county cases. It just updates that particular point, sadly, again, that death data point, just to be clear, so there's no lag or difference between what we're reporting on our site and what the state's reporting. So if you have questions about that, feel free to ask. There is nothing more than that, but we're trying to be very, very clear, very, very honest, and we want to be in a position where we're giving you the most up-to-date information possible. So our site is live again, and you'll see that information there. So let's talk a little bit about the data dashboard and some of the points that you will see. Again, want to give you an update as to our status. Over the course of the last 2 months, we've conducted 17,477 tests. That has resulted in 3,233 confirmed positive cases here in the county. Sadly, again, 96 deaths in Dutchess. Now, those deaths do include, if you're asking, obviously those who may have died at home, those who have died in a hospital setting, those who have died in a nursing home setting, and those who have died in a state facility in Dutchess County. And that is the total number at 96. Now, we have cataloged 951 recoveries, now with 61 individuals who are hospitalized. And do we have the hospitalization charts as well? Let's look at those because I do think they're... So you're going to start seeing more of these data points as the governor and the state have outlined 7 basic sort of indicators for restarting activity, but also for monitoring that activity. So this hospitalization average, you'll see already that number starting to decline. And as I said the last time we met on Wednesday, 2 weeks ago, I said you could see daybreak. Well, we've begun a new day. This is the next day of our response to this pandemic, and that is now focused on what are regular declining numbers in hospitalizations. We see a decline in the severity of those hospitalizations. We have seen a stabilization, if you will, of active cases, and now we're tracking a modest, decline. And from that perspective, we are moving in the right direction. Now, we have another hospitalization chart, or we're going to go to that one just so you have it again. 61 hospitalizations against what are some 500 beds of capacity, and you'll see this chart which shows you in the gray area the total capacity and then the decline in those hospitalizations. And now all of that is critically important for us to restart and reopen activity, and we're focused on that. So number one, dashboard's been updated, and we want to get to some questions. Let me see if there are any that are any relation to the data points that we just went through. Otherwise, I promise we'll get through a few of them. Let me get some news out, and then we'll answer these questions. So let's start with testing and a new site that has opened up in the city of Poughkeepsie. Mayor Rob Rollison and I have been working with Rite Aid. I'll be very candid with you. We tweeted Rite Aid about 2 weeks ago, and they responded. And you likely know that beginning on Monday, May the 11th, Rite Aid in the city of Poughkeepsie will begin a drive-through testing location. This is this is self-swabbing, the shorter swabs, and Rite Aid is providing this at multiple locations across the country, but the Rite Aid location will be open Monday, May 11th. You do not need to show any particular symptoms, but you must provide an identification and be at least 18 years of age to be tested, and they'll begin on Monday, May the 11th. And I want to thank Legislator Randy Johnson, Legislator Barbara Jeter Jackson, and Mayor Rob Rollison for working so hard to get that site up and running. Now, this is a complement to the transportation program we have. If you are in the city of Poughkeepsie and you want to access a test, you now have the ability next Monday to go to Rite Aid, or you can contact the city of Poughkeepsie, City Hall, and they will coordinate transportation that the county's paying for to get you to a test at Mid-Hudson Regional. So you have those two options if you're living in the city. If you're outside of the city of Poughkeepsie and you have a transportation concern getting to testing, you can also call. Again, priority is given to the city of Poughkeepsie residents, but as we can accommodate, we'll accommodate others. Also today, I'm very proud that we were announcing a few small business initiatives that I want to discuss a little bit. The Think Duchess Alliance, working through our public authorities, the Local Development Corporation, and the Industrial Development Agency, along with our partners in Think Duchess, led by Assistant County Executive Ron Hicks. We're announcing today a Dutchess County Small Business Express Loan Program. We're establishing through the Local Development Corporation a small business loan program in partnership with Community Capital New York. This is a zero-interest loan program for small independent businesses within Dutchess County that have not been able to secure the SBA or PPP support or any other COVID-related aid. And this comes with an optional deferred payment, and loans are not to exceed $10,000. So this is the first of two initiatives that we're launching today. Small business loan program up to $10,000 for businesses that don't qualify under the SBA or the PPP. And you'll be given an opportunity to reach out, and we'll make sure that you know more about that program. Secondly, we're initiating our COVID-19 sales tax relief program. This is for manufacturers. The IDA will establish a no-fee fast tracking program to help manufacturers in the county expand capacity and produce much-needed PPE. This will help us attract and expand manufacturing opportunities. So for that purpose, again, the IDA will be voting on that program and managing that program. So two initiatives that we're launching today. Very important that we continue to support small businesses. And I'll offer to you that we have made perfectly clear that the federal programs have to catch up. They just are not adequate, they're not easy to access, and they're always overwhelmed. And while hundreds of millions of dollars have gotten to small businesses, so many are still waiting even for some response. So while Dutchess was one of the first in the state, Dutchess and Westchester had early designation under SBA. We still, however, the challenges are too great. And so while as the federal government, we demand the federal government continue to make improvements, we launched those two programs today. Very important that we continue to support our small businesses in the county. So a small business loan program and our sales tax relief program for manufacturers. I want to advise you that we're working, as we have been, with Ulster, Orange, and Dutchess counties have been coordinating together to collaborate on reopening and restarting activity. Today we held a meeting that included Dutchess, Ulster, and Orange, but also Columbia, Greene, Sullivan, and Putnam counties. And we're proceeding in an effort among these counties to coordinate restarting activity. And we're talking about steps that businesses could take to fit the expectation that Phase 1 may include certain businesses. And so those counties, those 7 counties, are all working together to coordinate restarting activities. And we're sharing best practices. We're talking through some frustrations, and we'll be developing protocols and ideas that we're asking and will ask the state to consider. So we'll take a couple questions before I get to a few more points that I want to cover. was asked about how long between phases 1 and phase 2. The governor has said today, in fact, that phase 1 would begin for upstate New York around the May 15th deadline or date of this unpause. We're asserting that Dutchess and those 6 other counties fall in upstate New York. I think the governor has made that in his public comments anyway, that Westchester, Rockland South is considered sort of downstate and has seen an impact from this pandemic that is much more severe, certainly, although everyone's struggling, but than upstate New York. Phase 1 is to begin May 15th, and the governor has said every 2-week increment thereafter we'll evaluate where we are against those 7 indicators and start to advance additional activities. Now, I'm going to say up front, I think in every phase, if we can craft policies that protect the public and the lives of those who are responding, if we can meet those protocols and keep the public safe, we're going to, as a region, continue to ask to include activities that should be restarted so that people can get back to living their lives. I was asked about the dashboard. How do you define recovered on the dashboard? It's a good question. Recovery is sort of an undefined category because, again, there's not a cure for COVID. We know that there's expected protocols. So if you've completed your quarantine period, you've exceeded a period of time beyond symptoms, you're deemed able to return to work or activity. So that happens by your doctor saying so, and in some cases the health department's making those determinations. Excuse me. So again, no clear defined medical recovery, but a certain set of expectations that you're no longer symptomatic and you've exceeded that period of time that you'd be quarantined, and that is how we then deem you as recovered. Darcy's asking if there's any follow-up from the governor about opening schools for those with special education services. The short answer is no, but we're going to continue to press. Do want to take this opportunity. I too share both fear and concern about embracing sort of third parties to reimagine education. I think that we ought to focus very aggressively on supporting schools, school teachers, families, and students. Certainly, use of technology is a tool has been happening and should continue to happen. But that the academic connection this personal connection that exists between a teacher and their students is critically important. Not to mention, I think redesigning education should be led by educators, families, students. And not necessarily third-party organizations. So we're going to continue to fight for special education services. I believe that there will be an effort to provide those services over the summer months, and you should continue to look for that as we will continue to press for that. Alice asked if you need a script, a prescription to access the Rite Aid testing. The answer is no. But if you visit duchessny.gov, you can get a readout of the additional information you need in order to take part and be tested at that Rite Aid location. Jeff's asking about businesses that might qualify to open in phase 1. So the governor has said that sort of the businesses that you can imagine, manufacturing, construction, we think that should include landscaping and contractors, so long as that you can meet some of that social distancing and personal protection requirements. We're going to push up against that. We think that, quite frankly, if Target and Lowe's and Home Depot can be opened under the essential business category, there needs to be some consideration for small businesses that are similar to be able to function with appropriate protocols and guidances, no question. But I will tell you that it is simply unfair to see major stores open, and of course I understand why they would, food and essential products, but if they can function in a safe manner, we believe that there are appropriate protocols that small businesses can function under. So number one is those things that you can imagine: manufacturing, construction, contractor. We believe landscaping and certain activities like that. You could imagine that maybe even a drive-in might open under phase 1 for certain services like graduations and commencement activities for schools. We think that there can be some other businesses, like some of our small retailers and others that can function, but we have to push for that. So that's what we're starting with and what we're considering. Tanya did ask about high school graduations. I wouldn't expect that you'd see a traditional graduation, but after May 15th, when the unpause or the pause ends, we're going to support certainly school districts asking for some creative ways to host graduation. So you could see them doing it virtually. We think that use of drive-ins is entirely appropriate so long as you've met certain protocols, and we're going to continue to ask that happens. I had a call with the school superintendents on Wednesday, and we'll be working with school districts to see if there's some creative ways to provide for commencement. I want to get to some questions. So barbershops and salons, I know a lot of questions about those. I wouldn't expect that will be phase one. We could envision that in the phase 2 step. So if I'm giving general advice, I would say that you're in that sort of June 1 timetable. I know that's a long time for many to have waited. But the real test will be as we start to open those doors at the end of next week. Have we and will we continue to manage those numbers? And every 2 weeks thereafter, we'll start to see some incremental adjustments. And I think that there are certain protocols that can be taken in that personal care area that would allow you to open in the phase 2 category, if you will. But again, our perspective is watch the numbers. And as the numbers hold and they decline, then more things should happen. And more things should happen so people can get back to work and lives can resume. And so long as we can manage those cases, because we were never stopping the disease, we're only controlling it so that we don't see a spike in hospitalizations, and that's sort of key. Will there be summer school for children with disabilities? As I said, we're going to continue to fight for that. There ought to be. We can't afford to have that population, young people with special education needs, see a significant regression. We're going to continue to ask for that. Marlene asked about salons and day spas. I wonder if that's Marlene Weber Day Spa. I'm a fan of many spas, but I've known Marlene for a number of years. We're hopeful, again, that at the end of May into the first week of June, that those are the activities that would start to happen again. And I think that there's some legitimacy that you can make that work and still provide for the protection of your employees and your customers. Our kids going to have summer camp. I will tell you, as I said earlier this week, we are advising municipalities and summer camps that they should prepare to be open with restrictions. We have a set of guidances that the Department of Behavioral Health has been developing. That should be finalized Monday or Tuesday of next week. We'll then share that with those entities that host summer camps. We'll ask them to apply with those protocols, and we'll consider them with the expectation that there'd be this timeline. So like campgrounds and RV camps and bungalow sort of seasonal communities, those will likely be permitted with protocols in place for Memorial Day weekend at the end of May. Traditional summer camps, municipal summer camps, if they meet those sort of guidances and they wish to proceed, we would expect that to occur the first week of July 1. So yes, we believe that summer camps can be managed, understanding that if you are a high-risk population or if you have some underlying illness, you shouldn't participate, in whether work or as a participant. And it is likely, as these activities start to open again, we are going to see new cases of COVID-19. We are going to see more positive cases. But again, if we can manage the severity, protect the vulnerable, and keep hospitalizations down, then getting back to life is really necessary. Phyllis, I want you to know that you are wrong. No one has cut my hair. This is actually what my hair looks like 6 weeks without a haircut. The guys at the Men's Room Barber Crew haven't seen me since the very last day we could get a haircut. And my wife doesn't want to cut my hair because she says that I will tell everyone, look at my haircut, she gave it to me. So this is it. I apologize, and I understand. Kim had asked about youth outdoor sports. We think, again, in the July timetable, local outdoor sports activities could be permissible. I would not expect to have travel teams or travel activities, but local inter-community or intra-community activities could be likely and logical and could be manageable if you protect the vulnerable populations in the July timetable, first week of July. Craig asked how many phases are out there. 4 phases is what they've identified, with the 4th being mostly like theaters, schools, large congregations. But again, I want to say this: everything that we plan for is bound to be altered to a degree, because as we've seen in some cases, certain activities can happen without much risk. Certain activities shouldn't happen because of risk, and we're going to have to assume certain risks as we open the door. As we see more activities, we're going to see people contract the disease. And that said, we want to manage it, protect the vulnerable, and protect lives, allowing you to get back to your lives. So that's what the governor's outlined. As I said, we're going to continue to make requests that's safe and deliberate. We're not taking risks here. I hope that you've seen us being even-handed and very calm about our approach. I understand that there are people on both sides of this argument who believe, we should just get back entirely, and those who believe we need to stay sort of in this pause. There are a number of reasons why we need to get back to certain activities. We want to be safe about it. We want to be certain that we're protecting people. Kathy asked about gatherings of 10 to 15 people. Well, not now, certainly. If you're out and about, we need you to keep those groups small. We're asking if you're out on the rail trail or you're visiting a park to try to stay with family, those in the same household, and always have a face covering. If you're out and you can't have that social distancing, you should have a face covering. Which reminds me to say that yesterday I did 2 television interviews, one on CBS and one with MSNBC. And you'll note with the CBS interviewer, he had a face mask on. We were at distance. He didn't want me wearing a face mask because he didn't think he could record me. But in the MSNBC one, we wore a face mask. And the point of me pointing to that is only to say there are certain circumstances where you're not going to come into contact with somebody. It's okay to not have a face mask on or face covering on, but have it on you, because there will be a moment that you may, walking down the sidewalk or on the rail trail or some activity or at the grocery store, where wearing a face covering for that moment would be appropriate. Kim asked about youth sports starting. I think we said basically we think localized intra-community. We envision could see some activity in July. Again, if the numbers turn or the state says absolutely not, we have to live within those parameters. But we expect the first week of July that some of those summer camp activities, outdoor activities would happen. We also need it. Families need the socialization. Kids need that socialization and activity. And from a financial perspective, you can't get back to work if you don't have some support for your children. And we want to be very safe about it. We're going to make those decisions with our other counties and within the framework that the state establishes. But we're going to continue to ask. Houses of worship, as of right now, Marta, you know that they remain closed for in-person congregation. I suspect that will start to sort of open up. I wouldn't think phase 1, but I also don't think it's going to be late into the cycle, because I do think that there's a recognition, as there ought to be, that the right and the ability for folks to come together to worship in the way that you do is, of course, to be protected and respected. And so, but again, it's going to be based on those numbers, and we're right now asking you to be safe about it, about what we're doing. Continue that stay at home, continue to stay local, continue to be to be in small groups. Generally, better if you're staying in a group that's from your household. If you're out and about, how that face covering, very, very important. Will kids be able to register for kindergarten? First, register for kindergarten. If your children are supposed to start kindergarten in September, you should plan to register. School districts are operating under the belief that there will be some school in September. Now, will there be certain protocols internally that need to be addressed? Absolutely. But we should function as if kids are going back to school in September. They need to. We need that to occur. And, of course, we want to do that safely. And again, I think you'll see things like more and more consideration for the personal hygiene, some social distancing. Some of that is not going to happen in a student setting or in a kid setting. So you're going to obviously we're going to ask those that have underlying illness, those that might be vulnerable to not participate in certain ways, and there'll have to be certain accommodations made. When can we have weddings? Well, you can have a wedding anytime you want. You just can't have people together right now. I know that's not what you're asking, but right now we would expect that to be in the phase 4 period, which is sort of this later time when larger groups can come together. Now, Dutchess County has a series of work groups working on protocols. We have, in fact, leaned a lot on the private sector to help draft those protocols, and we think there are certain ways that you can be safe about certain of those activities. But right now, large settings, obviously larger social gatherings, just not a smart idea. As far as weddings are concerned, I did say this the other day, the governor has provided that we can perform weddings virtually. County executives can officiate weddings, so if you're interested, I'd be happy to marry you. Well, marry the two of you. I'm already married. So anyway, that's an opportunity, but not for a group setting just yet. Question regarding the culinary. There is an effort to try, the Culinary Institute wants to try to be open in the month of June. I can't say that that's going to happen or not. They're trying to establish some protocols that would allow them to function. Of course, colleges want to be open for the fall semester. The culinary is a little bit unique because they have a different sort of class structure. I don't know if they're on trimesters or so they have they have trimesters throughout the year. So they want to try to be open in the June timetable. There may be some availability for that, but I would suspect that it'll be somewhat constricted and limited. However, colleges do want to be open in September, and we're hopeful that that can happen, and are working with our colleges to make sure that we have the steps and guidances in place for that to happen. Let me mention to you that last night the Dutchess County Legislature met in committee. This is their May committee meetings. We've asked them to take action on a few items. I want to mention 2 steps that they're taking on Monday if you want to express support for them. Number one, we've requested $1.6 million for purchase of PPE. County governments are going to continue to supply PPE to frontline responders. We're going to do that in partnership with the state and those other counties that I mentioned. So we are asking for that at full appropriation. It did pass committee. It's going to have to pass on Monday night, and we're hopeful that we can continue to make those kinds of purchases. So we're replenishing from the thousands of pieces we've purchased and distributed, and we're going to continue to do that for frontline providers and frontline responders and those in direct care, hospitals, direct support staff, etc. We're also working with our business community as we reopen. We want to make sure businesses have access to PPE, and if we can create a way to make it affordable for them, we're going to do that. Because as businesses open, they're going to want to have face coverings. They're going to want to make sure there's certain protocols in place to make sure that there's protection. Secondly, the legislature is moving forward on a bipartisan appropriation of $100,000 to augment our food distribution programming. That $100,000 will be put towards supporting the Duchess Responds effort. And if you wish and have the resources to visit Duchess Responds, you can find that at duchessny.gov. Duchess Responds, if you need help, food delivered to you, transportation, or if you want to volunteer or contribute funds, you can do that at Duchess Responds. Those 2 steps taken by the county legislature, and on Monday night they'll be meeting for their May meeting for that to happen. Nate wants to donate 200 meals. Reach out to Duchess Responds. Visit duchessny.gov. Go to Duchess Responds. You can call the hotline if you wish at 845-486-3555, 845-486-3555, or visit duchessny.gov. Be happy to take advantage of your generosity. Sam and others, am I worried about New York City residents coming to Duchess if we open first? Number one, I'll be honest, we don't worry, we prepare, we plan, we respond, and we react. And I mean that quite sincerely. This is still an emergency. We have been planning for both the restrictions in place. We also have to plan for returning to some semblance of normal. So as we return to our lives, we are going to have people traveling. We know that that's going to happen. So the goal will be, I think, for the state needs to make clear if you're in a segment of the state where there is higher degree of cases, where there remains that same concern, then you need to stay home. It doesn't make sense, certainly, to travel if you think that you can if you have the disease or have contracted the disease, or that you would transmit the disease. So we're preparing for the expectation, right, for some reopening. And by the way, whether it's us or the counties just north of us, someone is going to open first. There's going to be more activity north of us than there is south of us. And that ability to move is real. That's a reality. We have to accept that is a fact we cannot change. We can only take precautions. So our precautions will be to message people very carefully, face covering, social distancing, and if you're coming from a location where you might have a higher density of cases, please be considerate. Don't travel, and and try to stay home, because that's the goal. But we are going to be we live in an open society. It's going to happen. So from our perspective, we prepare for it, we plan for it, we'll put in action our plan, and we will react to the realities on the ground. And if we see those numbers spike and we see hospitalizations come up, the state is going to say slow down, and that's not what we want. So we're going to continue to do that. Which gets me to one of the questions someone else asked about tracers, hiring contact tracers. Judith asked about that. So you probably know a little bit about this. You understand it. As positive cases become known to us, health departments across the state are reaching out to those who are identified as positive, trying to identify who you may have come into contact with. So the state of New York has asked how many tracers can the county support. We have a handful. We have eight teams of people who are doing contact tracing. We expect that we can have as many as 10, but the state of New York is going to hire as well. We've been advised that they're going to create some sort of single portal. So state tracers or county tracers would be notified of a case, and then we input that information. Now, the other thing that we are considering is some technology locally that will allow us to inform you if you came into contact with somebody who tested positive. And this is not meant to frighten anyone. It's just basically to say, to the question before, if there's activity and we're getting back to life, we just want to be able to tell people that if you've come into contact with somebody who's contracted the disease, you may want to be tested, you may want to self-quarantine, take precautions, because that's the most considerate and the smartest thing to do. So very calmly, very directly, we want to take advantage of those tools to make sure that we're slowing the transmission so we don't overwhelm that hospital system. And from our perspective, that I think is the best and smartest approach. We plan, we prepare, we will put into action our plan, and then we will react as criteria and conditions change. Jennifer asked if businesses should be calling employees back to work. If calling employees back to work, have them get tested. Here's the thing. If you don't have the disease, you won't test positive. And I know that sounds obvious, but as people come back to work, you'll be told of certain expectations. If you're experiencing symptoms that you think are, well, then you should be tested. If you've come into contact with somebody who may have experienced those symptoms, you should be tested. If somehow you've come into contact with somebody who's traveled or you've traveled, you should be tested. But no, having everybody who comes back tested is not effective, because not everyone is likely to have contracted. And those who have, in many cases, it's best to be tested when you think you have. Not to mention, right now, access to rapid testing is not as readily available as we would want. So you could be tested, and you might not have results for some time. So again, the smart move is, again, slowly and incrementally, we reopen, have activities start, if you believe that you may have contracted the disease or you've come into contact with somebody who has, you should be tested. Now, you can go to Rite Aid if you want, and that's a testing site, or you can call your doctor and be given a direction. But those are the steps that we would recommend. Ed is asking, what about gyms? Believe me, gyms being open are likely not in phase 1. I don't expect that they're at the end of things, but that community will need to take some steps, probably to lessen capacity, to make sure that they're not crowded, and also make sure there's personal, the hygiene and the protections necessary, the things that we've talked about already and we know. I would guess that is more in the June timetable than in May. But I don't think that those businesses will end up being later than June if the numbers stay where they are. And as somebody who does go to the gym, I can tell you that I like them open as well. But there are realities, and I think that's the direction that we would give, and that's the timeline we would expect. Bridget's asking about unemployment. The unemployment system is administered by the state of New York. It is overwhelmed. We have said this from day one. It is not working. It just isn't. The system is not adequate. It is too cumbersome for too many people. And by the way, that has caused not only frustration for you, as you wait for those checks, but also the people who finally talk to you. Those are good and decent people who are working for the state, trying to provide that service. And frankly, the technology isn't there, and the system has just not worked. So we join those others in asking the state to continue to improve that system, but it is not functioning effectively, and it needs to. That said, keep at it, be patient. I know that's a lot to ask, and when you finally do qualify, your benefits will go back to the time of severance, the time of firing, the time of unemployment, the time of unemployment moving forward. Michael was asking about agencies like ARC, the Arc of Duchess, Abilities First. Right now, some of those services can function. The group settings, again, I would not expect group settings to be fully constituted until the first week of July, based on what we know are sort of this incremental restart of activity. That's the direction that we would give at this moment. If you have any additional questions, simply write them in the comment below. We'll be happy to take what questions that you have. Apologize, but just to recap on a couple items today, as I said, the 7 counties of the Hudson Valley have met: Dutchess, Putnam, Columbia, Greene, Ulster, Orange, and Sullivan. We've agreed to continue to collaborate together. We're talking about protocols for businesses to reopen, coordinating that activity, and pushing up to the state of New York consideration for that to happen. We're talking about sharing and the purchasing of PPE and some other ideas that we're working on together. We're going to continue to do that. Earlier today, we announced 2 programs for small businesses in Dutchess. Dutchess County is launching a small business express loan program for those businesses that don't qualify for PPP and the SBA loans. These are loans up to $10,000, along with a sales tax relief program for manufacturers that are scaling to make products PPE products and other products that are in high demand. This is a tax relief program that we're launching today, sales tax relief program for those manufacturers as well. We think very, very important to continue to support. When are you starting the opening for county employees? Well, county employees are working and we are open. It may be slower at times than you wish, but all aspects of county government are functioning to a degree. So if you're looking for a county activity, I don't know if you are a county employee. If you're not a county employee and you're looking for some government activity, visit duchessny.gov. Or follow us on Facebook or Twitter. You'll see our direct contact information for all of the departments that are functioning, and you can reach out to us for support. We do expect that Phase 1 will include starting to bring back some county employees. We have, in fact, the Deputy County Executive today, Bill O'Neill, is going through all of our reconstitution planning. Every department's been charged with coming up with a plan to protect the vulnerable populations, to accommodate those who can or shouldn't come back to work yet, and to expand, obviously, access to services. We expect that to begin the week after May 15th. So May 18th, we expect and hope that certain aspects of county government will start to ease back. Many of our staff are already obviously working. Actually, a good number of our staff are still reporting to offices. And Dutchess County government remains open. Florence, I am sorry about your 16-year-old. The DMV will not open yet. To that 16-year-old, be patient. I know that many of you are all waiting to get your driver's permits and your licenses. The DMV is not yet open, although you can envision some aspects of DMV services to open in that Phase 1 window. So May 18 to the end of May, you'll start to see some of those things happen, and I'm sorry that you have to wait for your driver's license. I really am. But if the 16-year-old's listening, please give Florence a break. This is not something that she had happen. Are elective surgeries allowed in Dutchess, asks Gary. Yes, they are. Hospitals and other providers like Orthopedic Associates and other facilities, Caremount and some others, they all have to establish have established plans to restart those activities, and they can begin to have those types of activities. And that was permitted about a week ago. That I hope answered that question. Amber, will the Wilcox Park Beach be open? We are hopeful. that we could have Wilcox open in the July timetable. And again, same as municipal parks, municipal pools and municipal lakes. We're asking municipalities to develop protocols. They can choose not to do this. They can choose simply to stay closed. But we are giving them the ability to come up with some protocols that accepts, first, that kids are not going to social distance in a pool or a lake. That's just not going to happen. So we have to accept certain risk, and that is a risk that you would take if you wish to go. But other activities, we can engage in social distancing, we can protect, and we're saying to those that we permit, Wilcox is a county park or local lakes or pools, that you should plan to develop a strategy to open in the month of July with appropriate protections. And again, I said, do we have that slide, that pledge that we're making for folks? I want you to see it again. This is just a reminder. I really, I don't know why, I just feel it's very important to reiterate this as clearly as we can for all of you. So this is basically our pledge. I mean, we're saying that as we take these steps forward, you should expect certain things from us. First, the collaboration. We're working with towns, villages, and cities, school districts, and our partners in other counties, other layers of government, state and federal government, to make sure we get to you the strongest partnerships possible. You should expect us to be exceptionally clear. So we're trying to tell you exactly what we know when we know it. We're going to be honest about our plans and trying to be clear about that with you and very specific about what we're doing. So honest about those risks, specific about those plans. That's the pledge that we make to you, because as we start this reopening activity, there are going to be a lot of questions, more questions than there are answers. So we're telling lakes, pools, parks of that nature that we permit that you should develop your guidances on protecting the public. We will explain that you're going to take certain risks. It's possible you go out and you come into contact with somebody who's sick. It is possible you get sick. So those are certain risks that we will take that you would have to decide is a risk that you want to take. And we expect that those activities could reopen to some degree in July. Where does loved ones come into play? Visiting loved ones. Well, I mean, again, you have the right certainly to visit a family member. That said, if that family member is vulnerable and living, in a home but vulnerable, you may want to, not do that for the time being. You may want to just do that from, a great degree of social distance. I will tell you that we have neighbors whose parents visit and they sit at one end of the outside porch and their family sits at the other end of the outside porch. They have their meal together and they go back about their business. That is entirely your call. And if you can't engage in that social distancing, make sure you have a face covering to be considerate of for your own health and for the health of others. When it comes to visiting individuals at a nursing home or a facility of that nature, they're regulated by the state of New York, and that hasn't changed as of yet. Diane was asking about the results from the Duchess Stadium site. There are those who get those results in 2 days and some who don't get them for 14 or 15 days. That is more a result of the lab. So the test is done there. That test is then sent to one of a couple labs. And depending on demand and turnaround time, it could take long. Believe me, Nuvance, who's our partner there, doesn't want it to take that long. We don't want it to take that long. But some tests come in longer than others. Some are very quick, and that's sadly the result of a system that just has been overwhelmed by the number of tests being taken. We have about 10 more minutes. If you have a question, please ask it in the comment below. I'm happy to take some questions. This week and this month is a time to recognize a whole host of people. So I want to take this moment to recognize, of course, those nurses working on the front line in public health and private healthcare facilities, those nurses that are working, and those direct care staff who are working with those with disabilities or our seniors. Very, very grateful to all of you. I know that at times it feels like you're sort of a single ship at sail, all alone, but there's a community that supports you, and we're grateful for the work you're doing. It's also National Correction Officers Week. These are men and women who are providing important service to Dutchess County and to individuals all across this country. To those who are working in our own county jail, we thank you for the work that you're doing. We know that it's been a stressful time. We're thankful for what you're providing, and I can tell you that our staff works every day to try to help those individual inmates in our care. It's also Teacher Appreciation Week. I can tell you that there are a lot of parents at home who are more appreciative of teachers today than they've ever been. Having to take on some of that task and some of that role ourselves. I know that we can say thank you to our teachers, very grateful to those educators who have been sticking with our kids. I know in the case of my own children, of course, we've experienced this, right, using technology. They're providing some education over just in a digital sense or in a virtual sense. In some cases, teachers are visiting their kids, and they can do that from a distance. That's totally permissible, totally appropriate. And I encourage school districts to support that, especially teachers who might not see these kids again. They might be moving up. I really hope you as a school district not only thank your school teachers, they're doing great work, but encourage that sort of interaction. We think it's very, very valuable, and I can tell you that from our perspective, there is very little that could replicate or replace that personal connection between a teacher and student. This is also May. May is also Mental Health Month, and I want to recognize the fact that we are all under a great deal of stress, and I'd offer to you that the emotions and anxieties that people feel are entirely valid and appropriate. Here in Dutchess County, we administer very comprehensive mental health services. I want to acknowledge our Deputy Commissioner for Behavioral and Community Health, Dr. Jackie Johnson, who oversees our mental health staff. I'm very grateful to her and all of the men and women who work in Dutchess County's Behavioral Health, Mental Health Division. We're very grateful. We continue to operate our stabilization center 24/7. We're using telepractice, so if you're dealing with drug addiction or you have a mental health concern, that stabilization center remains available to you, as does our helpline. You can call or text 845-485-9700, 845-485-9700, and we're available to be of help to you. 1 in 5 people in this country experience mental illness, and it's nothing to be ashamed of. It's a stigma that we hope to confront, and we encourage you to take advantage of the tools and resources available. Karen and some others are asking if we know if we qualify to begin reopening. Great question. So as I said, the governor's outlined these 7 indicators that we're using as a sort of a monitoring tool. Next week, I hope on Wednesday at our town hall, we'll be able to show you exactly how we meet up on those indicators. But I can tell you right now, Dutchess County, we believe that we actually meet 6 of those 7 indicators, and with some clarification from the state, we believe we meet all 7 currently. Now, we're going to be considered in a broader region. As I said, we expect to be considered not hindered by Westchester and Rockland, but we get considered on our numbers. And so we expect that we already meet 6 of those 7 indicators and hope to meet and expect to meet the 7th next week. But you should start looking. We'll be showing you a dashboard on that too, how we compare against those indicators. And I think that'll be critically important as we move forward. You'll be able to monitor that. But we have turned the corner. This is the next day in our response, if you will, to this pandemic. And we're making good progress. Roseanne asked about libraries. Well, first of all, libraries are available to you electronically and virtually. Many of our libraries have those tools available. We think that libraries could function just as you would, just as a restaurant would, right? You can have social distance. You can pre-order, if you will. You can get curbside. We think that libraries can function in that environment, and we think that that can happen sooner rather than later. We are happy to support our libraries. One of the few grant programs we're able to sustain at the moment, providing support directly to libraries. We're actually awarding certain dollars for them next week, and part of a contract that will happen throughout the remainder of this year to enable them to use new technology in their libraries. And we're very hopeful. We're very happy to be supportive. Maureen's asking if we're lumped in with Westchester. The better question is, are they lumped in with us? We're told that Westchester Rockland will be considered on their numbers. They're downstate, we're upstate. So all I can tell you is that the planning process will include Westchester and Rockland, but we believe will be measured by our data, and we are asserting that we ought to be considered on our data, and that's why the 7 counties I mentioned before, Dutchess, Ulster, Orange, Putnam, Sullivan, Greene, and Columbia be considered on our numbers because we function as a region. Catherine asked where you can find a list of essential businesses. If you visit Empire State Development Corporation, their website, ESDC, Empire State Development Corporation website, you'll see those lists of essential businesses. And if you visit DuchessBNN.com, Duchess Business Notification Network, DuchessBNN.com, you'll find a link to those essential businesses as well. As we wind down this afternoon, I want to take this moment to say thank you to all the moms in our lives, and those, whether biological or otherwise, who have been there caring for children. I can tell you that I don't know that we could more appreciate our moms than perhaps this last experience, right? Our mothers have, these last several weeks together, our mothers nurture us, they care for us, and they provide such important relationships. And so for Mother's Day this Sunday, I wish all of the moms watching, all of those mothers across Dutchess County, and those who play a mother role through adoption or fostering or simply through being a mentor to children, we thank you for that. And I want to take this moment to express my personal thanks to my own mom, Donna, who raised 3 exceptional boys, 2 of whom are very, very successful. The third is county executive of Dutchess County. But my mom is about the strongest woman I've ever met, and we're very grateful for the love and care that she has provided us. And in these moments where we're sort of socially distant, we know the value of that relationship. I also want to express my love and appreciation to my wife, Corinne, who is a tremendous, we have a blended family. My wife, Corinne, is a tremendous stepmom and a wonderful mother to our children. And I can only tell you that I don't know how she's held it together these last 60 days. And quite frankly, we as a family wouldn't have held it together without her. So she's been doing some amazing things with our kids and has been very patient with the work that we all do here in county government, and most notably has been very patient with me. So to all of our moms, thank you. We love you, and we're grateful for you. And to all those kids out there watching, no matter how old you are, if you still have your mom in your life, take this opportunity to reach out to them. We can be physically distant, and we have been physically distant these last few weeks, but we don't have to be emotionally distant. It's very, very critical, I think, that we continue to have those human connections. So if any last questions that we want confronted, if not, I want to invite you next Wednesday. We'll be live again in the evening. We have a Facebook Live town hall along with a telephone town hall, and then the following Friday we'll come to you live. And our goal here, again, let's put that pledge up one last time. We'll end on that. Just as a reminder, our goal is to be with you every Wednesday and Friday in a live setting. Made some announcements today, but we think as we start this restarting process and more information becomes available, it's going to be rapid, and we really, I think, should be as clear with you. So these are the things you should expect from us. We're going to continue to collaborate with our neighbors and local partners and work together with you to get back on our feet again. You should expect us to be exceptionally clear. So if we have information, we're going to tell you what it means and what it doesn't mean. We're going to answer the questions that we have answers for and tell you when we don't. We expect, and you should expect, to be honest about the risks. There are risks to restarting activity. As we start up, people are going to get sick again, and we're going to have to be clear about those risks and make decisions together about those risks, and we'll be very, very specific about those plans, and we think that you deserve that. So that together we can protect lives and allow people to get back to their lives. So ladies and gentlemen, thank you for your time this afternoon. Please reach out to us at duchessny.gov. Follow us here at Facebook or Twitter. We're happy to be responsive to you. We work for you, and look forward to talking with you again next week. Be well, be safe, be kind, and please extend our appreciation and love to all the mothers in our lives. Thanks very much.